Hi, and welcome back to Radiant Rise. Today is Tuesday, and exactly 1 week ago today, I was walking into the hospital for surgery. That feels so strange to even say. 1 week. Because part of me feels like it happened yesterday, and another part of me feels like I have lived an entire month in the last 7 days. Last Tuesday, I walked into that hospital worried about surgery. I was thinking about pain. I was thinking about what they might find. I was thinking about whether I would wake up without an appendix or an ovary. I was thinking about recovery. I was thinking about getting home. What I wasn't thinking about was my breathing. I wasn't thinking about oxygen. I wasn't thinking about my asthma becoming a problem while I was still under anesthesia. I wasn't thinking about postoperative hypoxia. I wasn't thinking about atelectasis. And I definitely wasn't thinking about being admitted to the hospital instead of going home. I talked about all of that in episode 13, and I'm not going to retell the entire story today because this episode isn't really about what happened medically. It's about what happened after, emotionally. Because something I've started to realize over the last few days is that sometimes the crisis itself isn't when you actually process the crisis. When something scary is happening, your brain has a job. Get through it. Listen to the doctors, answer the questions, take the medication, do the breathing treatment, use the spirometer, watch the oxygen numbers, get through the next hour, get through the night, get home. You're surviving, and then eventually you get to go home. The monitors are gone. The nurses aren't walking into the room every few hours. Nobody is checking your oxygen every few minutes. You're back in your own bed. You're surrounded by your own things. Everything is quieter, and suddenly, your brain doesn't have to concentrate so hard on surviving the immediate moment. And that's when something else can happen. The adrenaline starts wearing off, the noise stops, and your mind finally starts saying, wait, what just happened to me? That's where I am right now. And that's what I want to talk about today, the emotional crash after the crisis. One thing I've been thinking about a lot is how strange survival mode can be. Because when you're actually inside the crisis, you might not even feel everything you're going to feel later. You think that the scariest moment would be when something scary is actually happening. Sometimes it is, but sometimes you're too busy getting through it. Your brain starts narrowing down. What's happening right now? What do I need to do right now? What did the nurse say? What did the doctor say? What's my oxygen? Can I breathe? Can I stand up? Can I go home? And everything outside of that becomes background noise. Looking back now, I realize there were moments in that hospital that were genuinely frightening. But at the time, I wasn't sitting there fully processing. This is scary. I was just living it. I remember needing oxygen. I remember the breathing treatments. I remember being told I couldn't get out of bed without someone helping me because they were worried my oxygen could drop. I could get dizzy and I could fall. I remember the monitors. I remember so badly wanting to go home. I remember being told from a surgical standpoint I was okay, but my breathing was keeping me there. And eventually, I remember hearing that I was no longer considered critical. At the time, those things were checkpoints. Okay, what's next? What needs to happen so I can get home? But now that I'm home, some of those moments hit differently because now I have enough distance to think about them. And I think that's what people sometimes misunderstand about trauma or frightening experiences. You don't always fall apart during the crisis. Sometimes you fall apart afterwards. Sometimes during the crisis. You're incredibly calm. You're practical. You're focused. You're doing what needs to be done. And then 3 days later, you're sitting on your couch thinking about one sentence somebody said in the hospital, and suddenly you're crying. Not because something new happened, but because you're finally safe enough to feel what already happened. My body knew something serious was happening before my mind fully understood it. My body was struggling to breathe. My oxygen was dropping. My lungs weren't fully expanding the way they needed to. My asthma was acting up. My body had undergone surgery and anesthesia. My body knew. But mentally, I think part of me was just trying to understand and complete the mission. Get home. And I did. I came home. And I remember how relieved I was. There really is something about coming home after being in the hospital that is difficult to describe. Your bed feels different. Your pillow feels different. Your shower feels different. Even sitting on your own couch feels like a luxury. And I was so grateful. I still am. But being home didn't switch everything off emotionally. My brain didn't say, okay, we're home. Everything is fine. Delete the scary experience. Instead, I think my brain started doing the opposite. It started replaying pieces of it. Not constantly, not dramatically, just little moments, a sentence, a feeling, a memory. Hearing that they couldn't send me home, remembering the oxygen, remembering how weak I felt, remembering that I couldn't just stand up and walk around without somebody there, thinking about the fact that my breathing problem actually started while I was unconscious. And there's something about that part that still gets because I couldn't advocate for myself. I couldn't tell anybody how I was feeling. I couldn't say something is wrong. I was completely unconscious. My body was in someone else's hands. And thankfully, the medical team recognized what was happening and took care of me. I'm incredibly grateful for that. But gratitude doesn't erase the fact that it was scary. And I'm learning that those two things can exist together. I think sometimes we put pressure on ourselves to choose one emotion, especially after something turns out okay. You're home, so you're supposed to be grateful. You're recovering, so you're supposed to be positive. The crisis passed, so you're supposed to move on. And I am grateful, deeply grateful. I'm grateful that the medical team noticed when my oxygen and breathing became a problem. I'm grateful they treated me. I'm grateful they monitored me instead of rushing me out the door. I'm grateful that I eventually maintained safe oxygen levels without supplemental oxygen. I'm grateful that I'm home. I'm incredibly grateful. But I'm also allowed to say that scared me. I'm allowed to be grateful and shaken. I'm allowed to feel relieved and exhausted. I'm allowed to know that I'm okay now and still think about how quickly things changed. I'm allowed to appreciate the people who took care of me and still hate that I had to go through it. Emotions don't have to cancel each other out. That's something I'm trying to remember because sometimes when you've been through something difficult, people naturally want to reassure you, but you're home now. You're okay. Thank God everything worked out. And yes, absolutely. But sometimes you're okay now isn't the same thing as your brain has processed what happened. That's the difference I'm experiencing right now. Physically, I'm home. Emotionally, I'm still arriving. Coming home after a hospital stay is strange because you return to the same environment you left, but you don't necessarily feel like the same person who left it. Your laundry is still there, dishes still exist, your phone still has notifications, emails still arrive, bills still exist, life keeps moving, and part of your brain starts telling you that because you're home, you should be getting back to normal. I've caught myself thinking that more than once. Maybe I can clean something. Maybe I can get some work done. Maybe I can organize this. Maybe I can answer everything. Maybe I can catch up. But then my body reminds me, you had surgery 7 days ago. You were hospitalized. You had breathing complications. You were on oxygen. Your body is still recovering. And apparently, my brain needs that reminder several times a day because I am not very good at doing nothing, even when doing nothing is exactly what I'm supposed to be doing. And when you're home, there are constant visual reminders of everything you normally do. At the hospital, nobody expects you to clean the bathroom, do the laundry, cook dinner. You're the patient. Your job is to recover. But when you come home, you're suddenly surrounded by your regular life again. And that's where the mental battle starts. Because physically, you're still a patient, but mentally, you're looking around thinking, I should be doing more. And I'm trying to change that. Because right now, resting isn't laziness, recovery isn't inactivity. My body is doing work even when I'm sitting still. Healing is work. Breathing deeply when my lungs need it is work. Getting up and walking safely is work. Eating enough is work. Sleeping is work. Managing pain is work. Listening to my body is work. It just doesn't look productive in a way we're normally taught productivity is supposed to look. One part of this experience that has stayed with me is how quickly my independence changed. I walked into that hospital on my own 2 feet, and hours later, I wasn't even supposed to get out of bed with help. That affected me emotionally more than I expected because I like being independent, even when I'm sick, even when I'm in pain, even when I probably should ask for help sooner than I do. There is something difficult about needing somebody else for basic things you normally wouldn't even think twice about. Standing up, walking, reaching something, carrying something, getting comfortable, making food, taking care of things around the house. And logically, I know that's what recovery looks like sometimes. I know needing help for a while doesn't mean I suddenly lost who I am, but emotionally, it's hard because chronic illness already takes away pieces of your independence. There are already days when pain decides what you can do. There are appointments you have to schedule your life around. Symptoms cancel plans. Fatigue changes what you're capable of. And then surgery comes along and makes that dependence even more obvious. I'm working on accepting help without turning it into a judgment about myself. That's harder than it sounds. Sometimes accepting help feels vulnerable, feels frustrating, makes you feel guilty. Sometimes you worry you're becoming a burden. And I think that sometimes a lot of people who live with chronic illness struggle with. We don't necessarily mind helping other people, but when we're the ones who need help, suddenly our brains start keeping score. How much have I asked for? Am I asking too much? Are they tired of helping me? Should I be able to do this myself by now? And I'm trying not to do that. The people who love me would rather help me heal properly than watch me hurt myself trying to prove I can do everything alone. I know that. I'm just teaching the emotional part of me to believe it too. We use that phrase a lot, bounce back. After surgery, after illness, after having a baby, after grief, after trauma, after anything difficult, when are you going to go back to work? When are you getting back to normal? Are you feeling better yet? And most of the time, people aren't trying to pressure you. They're asking because they care. But when you're the person recovering, those questions could start becoming a clock in your head. Am I supposed to be feeling better now? Should I have more energy? Why am I still so tired? Why does that still hurt? Why am I emotional? Why can't I concentrate? Am I trying to resist that timeline? Of course, because my body doesn't owe anybody a fast recovery, including me. I think that's the part I need to hear the most. My body doesn't owe me a performance. I can't bully myself into healing faster. I can't guilt myself into having more energy. I can't create a perfect recovery timeline and then become angry with my body when it doesn't follow it. Healing is going to take however long healing takes. And after everything my body has been through, maybe it deserves a little patience from me. I found myself more emotional since coming home. Sometimes I know exactly why, other times I don't. There are moments when I feel completely fine emotionally, and then sometimes something small happens. Maybe I'm tired, maybe something hurts, maybe I remember something from the hospital, maybe somebody asks how I'm doing, and suddenly I feel tears coming. And my first instinct is sometimes, why am I crying? I'm home. I'm okay. But that's exactly the point. I'm home. I'm safe. My nervous system doesn't have to stay in emergency mode anymore. And maybe those emotions were waiting until my body wasn't fighting the immediate crisis, waiting until I was sitting somewhere familiar, until there was enough quiet. There's an emotional exhaustion that happens when you've spent months dealing with your health. And this didn't start last Tuesday. This particular chapter has been going on since September. Months of pain, symptoms, doctors, testing, hospitalizations, bleeding, anemia, questions, appointments, fear, trying to work, trying to function, trying to keep life moving. Then suddenly surgery. 2 weeks to prepare, then surgery day, then breathing complications, then hospitalization, then recovery. When I put it all together like that, it makes sense that I'm tired, not just physically, emotionally. I don't think our minds divide experiences into neat little boxes. September goes here, hospital stay goes there, surgery goes there, work stress goes somewhere else. It accumulates, and eventually something inside you says, I need a minute. I think that's where I am. I need a minute. There's also another layer to all of this. I still haven't had my post-op appointment. That's next week. And like I said in episode 13, there are things about the surgery itself that I'm intentionally not discussing yet. I'm not going to speculate. I'm not going to try to interpret everything myself. I'm not going to rush to tell a story before I fully understand it. I want to sit down with my surgeon. I want to ask my questions. I want to hear what she has to say. I want to understand what was done, what everything means, and what happens next. And then I'll decide what I'm comfortable sharing. That uncertainty is still there, but I'm trying to allow myself to live in the uncertainty without constantly demanding an answer from myself that I don't have yet. Sometimes the answer really is, I don't know yet. And that doesn't mean something is wrong. It means I'm waiting for more information. I've spent so much of this medical journey desperate for answers. I think I've reached a point where I'm learning that waiting is part of the process too. Not my favorite part, definitely not, but part of it. One thing I don't want to do with this podcast is turn everything difficult into an inspirational quote before I've had time to feel it. Sometimes something hard happens, and it's just hard. Sometimes you don't immediately know what you learned. Sometimes you aren't stronger yet. Something makes you just tired. And I think there's room for that here. Radiant Rise is about hope. But hope doesn't require pretending. Hope can sound like, I'm scared, but I'm still here. I'm tired, but I'm taking care of myself. I don't know what comes next, but I'll deal with it when it comes. I'm not okay today, but today isn't forever. That's enough for me. I don't need to turn last week into some perfect inspirational story. I don't need to say that everything happened for a reason. I don't know that. I just know what happened, and I know I'm still processing it. Maybe healing emotionally means giving yourself permission to tell the truth before you found the lesson. So, what am I trying to do right now? I'm trying to give myself time. I'm trying to rest without feeling guilty. I'm trying to accept help, to listen to my body when it says enough, to stop measuring my recovery against what I think I should be doing. I'm trying to recognize that feeling emotional doesn't mean I'm going backward, to remind myself that my nervous system went through something too. I'm trying to be patient with the fact that I might replay things for a little while. I'm trying to allow gratitude and fear to exist together, to stop demanding that I immediately turn this experience into something meaningful. And most importantly, I'm trying to talk to myself with the same compassion I would give somebody else in my situation, because I know exactly what I would tell someone else. You had surgery a week ago. You ended in the hospital unexpectedly. You had breathing complications. Your body has been through a lot. Of course you're tired. Of course you're emotional. Give yourself time. So I'm trying to take my own advice. 1 week ago today, I walked into the hospital. Tonight, I'm home, and I'm incredibly grateful for that. But this week has taught me something I'm only beginning to understand. Sometimes the emotional part doesn't happen during the crisis. Sometimes during the crisis, you're too busy surviving. You make the decisions, you listen to the doctors, you watch the numbers, you get through the next hour, you do whatever you have to do, and then eventually you get somewhere safe. The adrenaline starts fading, everything gets quiet, and your mind finally says, can we talk about what just happened? Maybe that's what this week is for me. My body is healing, and now my mind is catching up. If you're listening to this after your own difficult experience, whether it was surgery, hospitalization, grief, trauma, caregiving, illness, an emergency, or anything else that forced you into survival mode, I want you to know something. You don't have to immediately be okay just because the emergency is over. You don't have to feel grateful every second. You don't have to have a lesson yet. You don't have to stop thinking about it just because everybody else has moved on. Sometimes the tears come afterward. Sometimes the fear comes afterwards. You don't realize how much something affected you until you're finally safe enough to feel it. Give yourself room for that. For me, today marks 1 week. 1 week since surgery. 1 week since everything went differently than I expected. I'm still sore. I'm still tired. I'm still healing. I still don't have an answer, but I'm home. I'm breathing. I'm surrounded by people who love me, and I'm giving myself permission to recover emotionally as well as physically. No deadline, no perfect ending, just one day at a time. And for right now, that's enough. Thank you for listening. Thank you for continuing to walk through these unfinished chapters with me. And thank you for giving me a place where I don't have to pretend I figured everything out before I talked about it. I'll share more about the surgical side of this journey after my post-op appointment, once I've spoken with my surgeon and have more information. Until then, I'm going to keep doing what my body and apparently my mind need from me. Rest, breathe, heal, one day at a time. I'll talk to you again soon.